Satoshi, I just wanted to thank you for coming on. This is really cool, right? So, so you're a business coach, right? So you're up in Toronto, Canada, right? Very, very much of a distant latitude relative to myself in Dallas, Texas. And so most of the time we talk about, sales, B2B sales, right? As well as, a lot of business topics, a lot of macroeconomic type topics, so I think it's a good time to kind of pause right now and sort of kind of put the typical coaching modality aside and just focus on, with COVID-19, your being in Toronto, mine being down here is how are people reacting differently, north of the border, so to speak.
That's cool. That's cool.
Yeah. So just to kind of give a frame, and I'll throw the conch shell at you, is, here in Dallas, Texas, I mean, there is shelter in place, and people are barely even going out for groceries. Of course, everything from the salons and the barber shops, and that my hair's getting long. I'm freaking out about that. And then
I did it myself.
Yeah, you're looking pretty snappy there. So I did have an idea of an invention to do this, like put it on your head, just kind of cuts it clean. So
like
whoever, yeah.
Remember those, the Flobies?
The Flobies. I remember the suck and cut on the raining.
You put it on the vacuum cleaner, and then you just kind of do this. You don't remember that? That was like the product, that was like the infomercial product of like the decade in the 80s.
Yeah. Okay. Well, you're not that much older than me, but
I'm not using it
that wave. Yeah. Yeah. Can you? So you bought one, right? So you can pull it out of your closet and just go ahead and use it now in this time of crisis. Okay. First world problems. So the reactions are a good bit different, right? So myself here in Texas now, of course, I'm sequestered in, so I'm just seeing people walking their dogs, and that's about it, right? Traffic is obviously almost non-existent. Very much down, maybe not to the level of, say, like New York City or something, but significantly down. And myself, I'm actually going out to a farm stay, which is really interesting because I can go out. There's a lot of land, a lot of people with farms and ranches where I can kind of get away to. So bringing it back to sort of the sort of Canada and sort of how you're seeing people reacting, watching the news, right? So I try to not myself maniacally watch the news, but it's all very negative. It's all very focused on, this is, not enough response, right, from government officials, et cetera, right? So that's what America seems to be really, really focused on. So what's the delta, right, in terms of the reaction between, the Canada side of the sphere and what we just talked about?
So it's interesting you say that because I've always been a news junkie at heart, right? Like I want the latest information. I want things live. I remember I used to watch CNN during the Gulf War, right? And all the live footage, and I couldn't get enough of it. I just wanted to just sit and watch all day. But fast forward to now, we have a lot more information, a lot more data to kind of help us, with what's going on, and a lot more transparency now, right? So every day I'm always checking the Johns Hopkins dashboard and kind of seeing where that is, and looking at the trends and trying to make some analysis out of it. So any information, any type of news is always interesting for me. But the interesting thing for me is that, I get to see it from three different sides. So I watch a lot of the news in Japan and see what's happening there. Obviously, they're a little bit further ahead in terms of the situation, and I can start to see what's going on over there. What type of information are they disseminating over there? And then if I jump back to Canada, I get to watch what's happening in Ontario, where I live. But not only that, but I get to see the other provinces and their health ministers and how they're dealing with it. And so, I get to compare that. And then obviously from the federal level, the prime minister level, there's certain information that's disseminated out of there. Based on what I'm hearing, like in Canada, it seems like it sounds a lot more coordinated here in terms of of the information that gets disseminated here, and the timing that a lot of the shutdowns and stuff are happening. And so we seem to be a little bit more cooperative or collaborative amongst the different provinces and the ministers for each of those provinces. And so I feel pretty good about what's happening here, just because of the information that we're getting here from the prime minister level and then down. And sure, we have the same problems as the rest of the world with, the lack of supplies, where, personal protection equipment and in the healthcare system and so on. But I think the message is getting a little bit better here in a way that it's actually helping people to, stay physically distant and actually do what the government says.
To kind of loop it back really quick to Japan, I think that's really interesting, right? So you have optics in Japan, family, culture, back, and so we've actually talked about this before, right? This idea of wearing the masks, right? And so there's those cultural differences, right? Here in the U.S., if you wear a mask, you're looked at askance. People are saying, stay away, unclean, kind of thing. Whereas in Japan, you were saying that people were wearing masks, so they're protecting other people. So as a consideration for other people, so the culture was a little bit more, I guess, in a sense, ready in terms of how they think about how to prevent spread of disease. I would say, and I'm no doctor or whatever. I know we're still right now figuring out, do we all wear masks or not, right? That's back on the table at the White House level. So what do those conversations look like, and what's your perspective on, the culture of mask wearing, if you will, and has that helped to mitigate any at all, like within the borders of Japan?
Yeah, I'm a big proponent of masks, and I don't care if it's an N95 or not, or if it's a cloth mask. Anything that prevents the droplets, I guess is what they call it, from spreading is a good thing, right? And now that we know, I think from back in January, that you could be asymptomatic. You don't have to have symptoms, and you could still be a host. Yeah. So, and we've always been told, when you sneeze or in your sleeve or whatever it is, right? And, looking at you now, you're wearing a T-shirt, right? So, like, you can't really do it in your sleeve, right?
Yeah, I have to pull my shirt.
Right?
Yeah.
but I mean, everybody wears masks in Japan. Like that's just a given. And I remember distinctly, I used to wear a mask when I grew up in Japan. When I was 5 years old, even if you have a cough or a sneeze or anything, you always put a mask on. It's a cloth mask with a gauze in it, right? So you replace the gauze and you wash the rest of it. Anyway, when I came to Canada in 1980, I came in December 12th, 1980, and I remember being in kindergarten, and I did wear a mask when I was sick, like when I had a cough or something. And I wore that mask to kindergarten here in Toronto. And the teacher, and I remember this to this day, she's like, what are you wearing that for? Take it off. and I've never worn it since in school. But now it's all back on the table. Like for me, like we don't want to spread it to somebody else. Why would you want to do that, right? So I know the people are thinking, okay, well, it's more of a protective thing. No, it's not a protective thing. It's actually to prevent the spread. So, but I think if you have N95 and all that, you absolutely should be providing it to the healthcare system and donating it or whatever you have to do. But make your cloth ones. Like, what's wrong with that, right?
Yeah. Yeah. Interesting. So you were well ahead of your time. I mean, even as a kid, Japan's kind of thinking of this stuff. I think it's fair to say that, just from a physical perspective, right? If you are, let's just say, asymptomatic and, in terms of spreading or sneezing, et cetera, I think that just due to the culture mindset that, Japan would be at least be prepared to be ahead of the curve, so to speak.
I think I think there's other things too that,
Yeah.
and it's a cultural thing, right? Like if you compare, what's happening in Italy, you have people that are, getting transmitting and getting infected. I mean, Italians are in general, they're a very physically close culture, right? Where you're doing your greetings and kisses and hugs and all that. And in Japan, we don't do that. We don't even
Yeah.
shake hands.
Yeah.
We bow, right?
Yeah.
And so that's just part of our culture. We just don't touch people.
That is absolutely fascinating because so I've been to Japan very briefly, but just knowing, about Japan and the collective culture, that's almost too obvious now, right? Like there's not a lot of touching, and
Yeah.
so when you think about it, it's kind of strange, right, to do the handshake, in terms of like, well, why do we need to touch when we greet each other, so that's, I guess, it just evolves, right, that way over time, but to your point, in Italy, Europe, so I'm half Dutch, so even on the Dutch side, you greet each other by kissing I guess it's, well, depending on however, but you'd kiss each other 1, 2, 3, like my grandma, right? 3 times,
Right.
1, 2, 3, and it literally was 3 times. Like they would say, no, you have to do it 3 times. You know what I mean? And so you're right. If you push that out to all the culture, I mean, that's really going to change potentially the spread of disease. So that's a really good call out. No one has been talking about that.
And there's a third part. If you ever go to a fine, I wouldn't say fine, but a little bit more of an upscale Japanese restaurant, could be anywhere in the U.S. or in Canada. Japan, all of us get those little the steamed hand wipes, the hot towels, like in a little plastic bag, and before your meal, right, when you go to a restaurant, right, and so you get that little hand towel for each guest. And before every meal, like we're opening that up and we're cleaning our hands before we even eat anything, right? So that's a big one because a lot of people in Japan go out to eat and they're always serving those hot towels, right? Yeah. So I think just from a sanitary point of view, like it's built into the culture, right? It's not like you don't have to teach anybody to do it, and I think that's another difference too.
Mm-hmm. Yeah. Okay. Interesting. And then, okay, now to your point about Canada having a more cohesive strategy, like you had said, and everyone's critical. Everyone's going to be, finding faults in government response and whatnot. And certainly, looking back on this in retro, with the benefit of hindsight, there will be a lot of elucidation on what we could have done better, et cetera, right? And so, and certainly there's a lot of lessons that can be learned from other cultures and where the spread was faster. But on the U.S. side, just from what I've been gathering, it's really, the at the state level being driven in terms of what the guidance is, right? So the White House essentially has guidance, and the state and the governors, and at the municipal and county level, there will be specific orders, direction, again, shelter in place, etc. And so there's something that last I checked, about 12 states or so that have not issued any kind of shelter in place type of orders, and as it turns out, as you kind of expect, they're kind of in the middle of the country. Things go from the coast inwards, right? And so I'm not any expert on Canada, government procedures and whatnot. You had mentioned provinces. So is the dynamic from, at the highest level down to the province, is it directed downward, or is there a sense that the provinces can operate unilaterally in terms of how they're responding to COVID-19?
Yeah. Good question. So the model is very similar to the U.S., right? So the premiers that like your equivalent to the governors, they basically kind of dictate what happens in each province. Each province has their health ministers at the provincial level. And so you would think that, one goes out one way and does their thing, and the other would go and do their own way, which they kind of do. But on this particular case, everybody seems to be doing the same thing, like right away. So Yeah, I'm sure they're talking to each other, they're sharing information, and they're all coming to the same decision, right, at the same time. So it just looks coordinated. I'm not sure if they're just all agreeing to do it together, or if it's just the timing, right, that they're close. But in Canada, we don't typically care what, party you represent, right?
Yeah.
So, if I look at other provinces, like I don't know what party, is the majority over there, but they all agree in the same thing, right?
I've never seen a map of sort of, the red and blue of the provinces in Canada.
There is one.
There is one. So you picked the thought up right off my brain, in the sense that there is pretty much a clear line of demarc between maybe the response, but also the mindset, of either the Republican versus Democrat party, right? As one would expect, you'd have Republicans focused on the economy. When can we get things started up again, right? Saying things like, well, if we keep the economy shut down, then the cure, so to speak, or the fix for this is going to be worse than the disease itself, right? Keeping everyone in, right, is going to have impact, like broader, economic, social, political causes and fallout, right? And of course, you have folks on the other side of the fence saying, well, not saying that message, right? Saying like, no, keep everyone safe, get checks to the front line, the blue collar workers, et cetera, right? And that being much more the focus, so there is that line of demarc, right? Like, okay, keep the economy rolling because that's how we're going to take care of everyone. And then, less concern on the economy, have government like take more care of people, right? That's sort of the fundamental, right? So, and it's palpable, right? Because you go from one station that's conservative to one station that's liberal, the whole messaging almost changes instantly, So you kind of know where I'm going with this is the same dynamic happening in Canada, where you have across party, those, multiple party lines, whichever the main ones are. Again, do you see that kind of response?
Yeah, no, we don't have any of that. We don't, nobody, no province is saying, the economy is more important than this problem we have. Like, nobody, right? Granted, there's a lot of businesses that are seriously hurt, but at the same time, everybody agrees that at the end of the day, like, if you're not alive, you don't have work, right? So here, health is definitely number one. Having said that, right up until yesterday, I saw on the news here that people still weren't following this whole physical and social distancing thing. So the government had to step in, and at the municipal level, they have all these bylaws, and the city had to step in and said, if you don't follow it, then you could be fined, I think, up to $5,000 or something like that. So.
So wait a minute on that one, right? So everyone knows Canada as having a national healthcare system, right? So that's going to change a lot of how people think about this, right? So if you have the government more taking care of the healthcare, if I'm sickly, et cetera, particularly in this time, is the healthcare system also being over flooded, right? Because that's to the typical argument, right? So in America saying, well, if we're just like Canada or other, socialized healthcare systems, then you're not going to get the same level of care because either too many people are going to get healthcare or no one's incentivized to provide, good healthcare, et cetera. So how does that change the dynamic, right? Like when you're having a conversation about a lot of people getting sick, and the government essentially providing the care, does that mean, is the government have a mechanism to kind of turn the dials there, right? So that not everyone's just throwing themselves at the healthcare system because, hey, I'm not paying for it anyway, right? But the government's also think about, is there sufficient supplies and resources and manpower? So how does that calculus change with a national healthcare system?
So that's a good question. So like you said, we don't pay for healthcare. Like there's no like cashier in a hospital here, right? So
I think that's the only person I see when I go to the doctor. It's like you barely have time with the doctor, but you spend 20 minutes with paying the bill.
It's such a weird concept, right? Like I remember breaking my collarbone playing hockey, and got my X-rays and saw the ER and the doctor and everything else, and got pain meds and whatever. And the doctor's like, okay, you just get this and you're good to go. And you literally walk.
Yeah.
That's it. You just walk to your car, right? And but anywhere else in the world, like you said, like it's you always have to go and see the cashier after that, right? But that doesn't I would say it doesn't necessarily make the how prepared we are any better, right? Like it doesn't make us any more prepared for this type of situation, right? So there's more focus on this whole physical distancing and social distancing, and making sure that we're not, with anybody, and that we don't get sick, right? Because we know it is to begin with. And to your point, is actually interesting when you said, hey, it's free, so we should just go in and get whatever done, right? But that's not how we operate here. We know that, we don't have to pay for it, but we don't want to be there, right? If we need to.
Well, I would think that if anyone is on the fence, so me personally, I don't feel like I need to get tested. I think everyone can agree that more broadly available testing, should be available. In fact, I've asked the question of the people that have gotten tested that were very high profile, like I think Rand Paul, for example, and other celebrities in the NBA. It's like, how are they getting access to test? I don't know anyone that that has gotten tested. So my thought there is, if you're not paying for it and you're used to sort of being taken care of, and you can walk in, and you would think that if you're on the fence, right, I think I should get tested, that you'd be much more likely to go in to get tested. So that's where I was kind of going with that is
oh yeah.
It's much more likely to go in to get tested.
So I think the situation with testing is the same in the US. Like I don't think we're prepared for it either, right? So I know initially they said only get tested if you traveled or if you know someone who came out positive. So there's criteria, right? So so at that point, us who don't travel and haven't been in contact, we just don't bother, right? Because if we know that if we show up, or there's assessment centers now that are being built like across the city. So I think if you want to, you can. But in fact, they said that the ER, like the actual emergency rooms, we used to be like waiting like for 3-4 hours to see a doctor here, like before COVID. But now they're saying the actual ER departments are completely empty because nobody's coming in for broken arms and
fascinating.
Whatever.
Yeah.
So,
yeah. Because they're either turning them away, saying no, we need to save the resources for the actual response to the pandemic, or two, they're saying, I'm hurt, but I'm not that hurt enough to risk going out of my home, right?
Yeah. You don't want to go to a hospital either, right? If you're not, let's say you're not sick, like you don't want to go into an environment where you could potentially catch it just being there, right? But the one big issue we know is it's clear, it's the retirement homes and the long-term care folks that are getting impacted. And it's happened in Seattle, it's happening here. I think there's a long-term care home that got infected. I think 11 people have died already, right, in the last few days. So it's not it's not about it's about you getting other people sick. And I think here people understand that a little bit more. They appreciate that more. I remember watching a YouTube video the other day of a guy walking into Walmart, and he was tested positive, and he's just walking around Walmart going, well, I don't care. I don't care if I get other people sick. Like it's like, wow, right? Like
there's some people that are just cavalier about getting other people sick, or they're so self-centered and so narcissistic that I'm only gonna care about myself. And then you have some people that are basically of the mindset, well, I'm not going to have government tell me what to do, like
Mm-hmm.
the government, right? Kind
A
of thing,
free
right?
country.
Yeah, we're a free country, right? You're not going to tread on me, kind of thing. And so, and
Mm-hmm.
just to be clear, I'm not picking any like side of this argument. I'm just pointing things out,
Yep.
So,
Yep.
but to keep this at about 30 minutes or so, I wanted to open up one last topic. And that's really on business and specifically small business, right? Because your focus right now is growing your business
Mm.
and keeping that business alive, healthy, thriving, moving forward despite things. And so you would describe your current business focus right now as small business, correct? Right. And
Yep.
so of course here in the U.S. is uh, this idea that, well, for the small business folks that don't have the liquidity, don't have the cash flow, right? Because they just got started going, right? They're just happy just to have a certain amount of customers to get, buy from month to month. And that's pretty common, right? So you wouldn't expect someone to let alone bootstrap their own business and then, have 6, 9, 12 months of savings set up, right?
Right.
Because that's not how small business works, right? Like a lot of times you're taking a risk, and in general in America we incentivize taking that risk, and
Mm-hmm.
a lot of folks that are the founder of a company, I mean, they're loading up their credit cards and just trying to get their first couple customers, you know what I mean? So they're straddled with debt, right? But this is how the American economy flourishes, right? Because we incentivize that, and we have mechanisms to kind of mitigate if things go belly up. On one hand, I do feel a sense of, we should be helping small businesses and buttressing small business, because we always want to keep innovation going. We want to help the mom and pops, etc. We want to keep that level of the economy flourishing.
Mm-hmm.
And at the same time, there are businesses out there that they didn't just start up. They've been around for a very long time, and they've just
Mm-hmm.
been maybe gobbling up every penny they can, right? Not saving up for a rainy day, let alone for their employees saving up for a rainy day, just because they were negligent in that
Mm-hmm.
regard, let's say,
Right.
right? Because
Right.
I want to go ahead and call out that everyone that has even read a page of personal finance, what's the number one thing you do? You save up 3 to 6 months emergency fund, and look, if you've done that, kudos to you. And if we get 6 months and that last paycheck dried up, we're all in a world of hurt. Okay, what I mean? You
Mm-hmm.
did
Mm-hmm.
due diligence, right? You mitigated the risk properly, right? So anyway, so back to the small business side of things is, so in the U.S. they're talking about sort of like small business bailout. So is Canada also having that same kind of conversation in terms of helping the small business owner from that at the government level?
Yeah, big time, big time. So there are different types of benefits that the government's launched. So one for business as a small business, right? Just to make sure you stay afloat. Secondly, I think that they're doing up to a $40,000 loan, to interest free, and the first 10,000, depending on the situation, you don't have to pay back, right? So that's one. The other one is for the employees that work in these small businesses. So if you're a restaurant owner, they're going to pay up to 75% of their, right? So the business only has to come up with the other 25. So anything to keep people off employment insurance is what they're trying to do, right? So they're trying to incentivize businesses to stay not in, well, I wouldn't just say they say in business, because obviously it's hard to do business now, but if you can, the government's willing to pitch in to help there. So so that's a positive thing, and of course they're letting takeout food and essential services and stuff like that stay afloat. So the one thing I would say for small businesses is that, to your point, when you're talking about hyper growth, right? Everybody wants to grow, but now it's survival mode, right? This is not about growth. You're not talking about opening new locations, right? So I think, and this is what I've been telling other small business owners, is especially if you have inventory of products, whether you're a salon or whatever it is, you got to survive. So if you have to sell your items at below cost, then that's still money flowing in. Yes, it's at a loss, but you need cash flow. And so, I mean, a lot of businesses, they think, well, I'll just shut down, but it's like, well, you're sitting on inventory, right?
Yeah.
And you should be moving that inventory, even if it's at a slight loss. Secondly, out of all this negativity, and I'm actually writing an article about this, but out of all this negativity, there's always some creativity within it. And we know that businesses are never going to be the same. Whatever normal we come up with, it's going to be a new normal, whatever that means. And so I had a chat with my son the other day. I said, let's say a sports, everything goes back to quote unquote normal. Would you go to an LA Kings game or a Dallas Stars game or Dallas Cowboys game, right? Would you go, right? And my son said, I wouldn't go. Right? You're in the stands with 40,000 people. The guy next to you is coughing his lungs out, even though everything's, the government says it's fine. Like, we're not going to do things the way we used to. And so I think out of this whole negativity, you need to think about what are the creative aspects that we can, develop as a result of this. And it's all hidden, right? Right now it's all masked by this cloud of negativity. And so you can come up with different ways, and I can guarantee you, if I sat in a room with some business owners and they told me what their problems are, we could probably come up with some ideas that they can go and execute on. And again, it's all survival, right? So that's important.
Yeah, and you're in the professional sports, arena, so to speak, no pun intended, and so there is going to be some impact there, to the pro athletes that you're working with, and their impact to what happens when people aren't filling the stadiums. I mean, I'm just thinking, my goodness, like the new normal. If your even family is thinking about not going to the big games, or even a Cowboys fan, as maniacal they are, is thinking about not going to the Cowboys Stadium just down the road. I mean, my goodness, like that new normal is going to be crazy because it's so baked in, so inculcated into especially American culture. But of course, you got hockey, Canada, of course, and that's going to be really interesting to see. Of course, to me, I'm just kind of like shrugging my shoulders because I've never been that big into pro sports. So does it all shift to, virtual, right? What does that look like, right? Is it going to be teams playing, but, without all the fanfare and the pomp, of the, the halftime shows, right? And, the stadiums being filled up, right? What is that going to look like? So there's the new normals there, right? The new normals of business, right? And of course, shifting to more of a remote workforce. Businesses realizing, we don't need this huge office or an office at all, and so the company that owns medium.com did a thing where they say, well, this is what we've been doing all the time. We have 1,700 employees. That's all remote. So so everyone else just needs to kind of catch up, kind of thing. Now, obviously, there's the more, I would say, industrial era or service centric era, right? So and maybe like the new normal for restaurants. I mean, what does that look like, right? So that's going to be crazy. So to your point, it's like, people aren't going to the professional sports games, but ask yourself the same question. Would you want to go to that restaurant that we were at 2 months ago, kind of thing? I'd be curious his response there as well, So, and it's crazy because I'm a teleworker. I'm home office. This is my lunch break right now, actually. And then secondly, I'm probably the number one Uber Eats customer, so I'm always getting something. I don't actually like going into restaurants, and I haven't had to do that for the last couple of years. And so the new normal for me won't be as drastic as most folks' new normal, but nonetheless, I mean, the impact to those folks, of course, we're rubbing elbows all together, right? We're all in this together and interconnected, So that's interesting. The new normal is thinking about the new normal is kind of the new normal,
That is. So they say the problem is not the problem. The problem is how you think about the problem.
Exactly. Yeah. No, that's fascinating. Said like a true business coach. So, so to kind of adjourn here, and again, I want to keep it crispy. So for folks that might want to engage with you further, or maybe seek out your consulting or your business advice and insights, where would you recommend them to engage or reach out to you or learn more about you?
Yeah, so I'm all over LinkedIn. That's where you'll find me, and you'll find all the information there. So Satoshi spelled Satoshi, and Takano, Takano.
Perfect. All right. Very good. Awesome. Well, good. Thanks for carving out this time over lunch. I hope
Yeah, pleasure.
Listening got a little bit of insights into the differences in the culture, the differences in countries responding, some insights potentially into new normal or ideas for their business and how to thrive during this time, and also some personal insights as well. So hopefully this was a message of hope and positivity versus the fear mongering that was out there. So thank you so much, Satoshi. And I'm your host, David Drugli, though. You can also reach out to me on LinkedIn.
Awesome, man.
All right. Take care.